Okay, so let's continue with part 2 then. Now we're talking about a patient who did not receive a vaccination, but instead they got infected, whether it be via IV or what have you, right? So, or blood or bodily fluids. Somehow they contracted the infection. There's going to be 2 phases to this infection. There's going to be an acute phase. There's technically 3 phases, and I'll explain the 3 now, but we'll discuss just these 2. Acute means they just most recently got the infection, right? So they got a needle stick at work, they went down to the ER, they did some blood work, and there's an acute hepatitis infection happening right now. The second phase is they got infected, but they got over it. Now they're immune to it. And the third one, which we won't be discussing, is they got infected, but they're not getting better. That means their body is not responding. The immune system is not doing its job. So they have chronic, that would be a third stage, a chronic infection. And that's when we would talk more about HBE, which is reinfection. They keep getting reinfected, symptoms won't subside, yada yada. That's not for us right now. Instead, we're going to focus on acute versus immune. Okay, so let's then break down an infected patient recently. Someone who recently got infected, right? So what should we expect to see right away? Some of these we can knock out automatically. Remember going back to the core. So in the cell, going back to the cell, this is the surface, this is the core. When the virus first enters the body, latches on. Then it's going to take some time before it can get to the core of the cell. Excuse me. So if you think about it in that sense, anything core in an acute infection is automatically out. Whether it be antibody or antigen, core is out because it takes time to reach the core. Let's go ahead and make these negative. There's going to be no core activity. Now, as far as the surface goes, we know that the surface of the cell, that's something that definitely can be affected quickly or acutely, right? So the question is, if you're infected, what should we expect to see? If it recently happened, the antigen, which is the virus itself, has just latched onto the surface. So as you guessed it, this should probably be positive, right? So hemoglobin antigen should be positive. Now, because it's an immune response and it just recently happened, remember earlier we talked about IgM and IgG. We said IgM is acute, a non-specific acute response. So how can we confirm that this patient has an acute infection? Well, IgM is going to be positive, right? So in order to confirm and diagnose that this patient does indeed have hepatitis infection, and say they got a needle stick, they went down to the ER, you want to know if they're infected right now. 2 things need to be positive. Hemoglobin surface antigen is positive, and IgM as a response to the infection is positive. IgG, we said that's chronic, that's going to take some time, that's going to be negative for now. And a hemoglobin surface antibody, that's going to depend on how long they've had this acute infection. If it just happened, let's say a couple hours ago, it's going to be negative. Our body can't produce antibodies that fast, or at least not enough to show in our blood work. If they've had it now for a couple of days, yeah, maybe you're going to start seeing an antibody response, right? That's when it's going to start shifting to immunity. But for now, you can almost bet that for testing purposes, your antibody is going to be negative. So the only thing you're looking for positive is a hemoglobin surface antigen has to be positive. IgM has to be positive. Here I've given another example question. Let's see if we can zoom in on that. So we got a 32-year-old woman presents with a bunch of stuff, and we get to the end and the question is asking, which of the following tests indicates acute infection with hepatitis B that's causing this patient's symptoms, right? Acute is the only thing we care about. So the infection, it's not because of a vaccination, it's because they're infected and it's acute. So the only 2 things that are positive is either the answer choices have to either say hemoglobin surface antigen positive or IgM is positive. That's the only two things it's going to tell us that it's acute. Everything else we said is negative. So we look at our answer choices, and this is talking about an antibody or to E, so a reinfection, that's not for us, yada yada yada. And look what we have down here. IgM antibody to B, hepatitis B. So definitely IgM we know is specific to acute infections. The only other thing is antigen, which is not, it's not telling us antigen. These are antibodies to antigen, so it's talking about the antibody. So IgM is our only is our only answer choice really here, right? So, and that's how we tackle those type of questions. Let me quickly talk about immune. So the how it would look, how it would present if the patient had an infection, but now they've built an immune to it, right? So in this case, let's talk about the non-specifics. Should IgM be positive? No, because now after a while, IgM stops, IgG kicks in, right? So we should be looking at a positive IgG and a negative IgM. Now, does it have to be like this on blood work? Absolutely not. But for testing purposes, you have to kind of guide us in that direction, right? You have to tell us, hey, this guy's getting over it, right? So as far as the antigens go, which one should we expect to be positive? Could it have reached the core? Absolutely, yes. So now we're looking at a positive antigen. Can it be a positive surface? Technically, yes, it can be. So that's not really going to be, that's not going to change your answer. So I'm going to put here positive / negative. It could really be anything. It doesn't matter. That's not going to help you in answering the question. Now, as far as the antibodies go, that's important. Very important. Whichever one of these antigens is positive, if you're immune, you have an antibody against it. I'll repeat that. Whichever one of these antigens is positive, whether it be core or surface, you have to have an immune response to it, right? Your body had to have defeated it. And the way that it defeats it is by producing an antibody. So in this case, we have a core antigen positive. That means core antibody positive. You guessed it. In this case, we have either positive or negative. If it's negative, then this is probably, well, it could be positive or negative still, it doesn't matter. But if this is hemoglobin surface antigen positive, then you better guess that this is more than likely also going to be positive, right? So in order for the patient to have an infection, so if the question is asking, okay, the patient has an infection, but they're better now, or they've gotten over it, how do you know? Well, one, they have probably IgG is positive now, and whatever antigen is positive, they have an antibody to counter it, right? Every punch they throw, we have a counter attack for that. So we're blocking them from attacking us. We're now immune to it, right? I hope this helps. Good luck.